I love this quote in your book, which basically stems from what you're saying, that when a flower doesn't bloom, you fix the environment in which it grows, not the flower. And I think it's one of those like very simple quotes where we can start to understand like actually what is surrounding us that could be affecting us. And when I interviewed Dr. Lisa Feldman Barrett, she talked a lot about a metaphor of body budget. And we spoke a lot about our emotional health and our emotions. And she said, when we're depleted, our brain is in a body budget. And so we're drawing on other resources. And I found that a really clever way to think about our emotional health. And it feels very similar to how you talk about it. And you talk about something, I'm going to go into, biology very quickly, but the mitochondria, which is what many people who listen to the show will know is the powerhouse of the cell. And you speak a lot about mitochondria health in relation to our mental health and our mental well-being and, poor mental health conditions. So if we were to kind of take this down a little bit into a science, short synopsis, if people are saying, well, I'm changing my diet or I'm getting out and I'm exercising, but I still don't feel like I'm making profound changes with my mental health, what would you kind of talk to them about thinking about their mitochondrial health to help make it as powerful as possible? Or whether they're doing the right thing, pulling the right levers?
For some people, it's going to be more complicated. And working with a psychiatrist or a physician or mental health professional who knows the complexities of this and all of the different strategies can be really useful. So I just need to say that up front. Because I'm not at all trying to say I've got this simple 5-step recipe to treat all of the mental illnesses on the planet and everybody will get a miraculous cure, because that's not realistic.
Yeah.
And at the same time, I am saying do not give up hope. That if you understand the formula and in this science, we can actually help the overwhelming majority of people. I really authentically believe that. So even if you are one of the people that it's not going to be a simple fix with a diet and exercise plan, please don't give up hope. But the basics are really the basics of lifestyle medicine. So I would want to look at diet, nutrition. I would want to look at movement or exercise, sleep, good restorative sleep without the use of any substances. So that means no alcohol, no marijuana, no sleeping pills, no melatonin, you should be able to sleep. It means minimizing harmful substances, use. So that's alcohol, marijuana, but it's also maybe some prescription medicines and some other substances that might be harmful for your health. We could get into environmental toxins because they probably are playing some role, and that gets more complicated in terms of how you avoid them. But another pillar is stress reduction. So the basic things that a lot of people know about: meditation, mindfulness, just removing yourself from stressful situations. And then the last thing is often relationships. I kind of throw in purpose in life because I think they go together. It doesn't always have to be about relationships. There can be Buddhist monks who live kind of in isolation and have a very strong sense of purpose, even without a lot of romantic or other types of relationships. So I kind of throw those two together. But I think those are the 6 pillars. And if you make sure that all 6 pillars are in the green zone, so to speak, that you're doing the right things in those, then more often than not, I really believe most people will achieve optimal health. The trickiest one of all is actually diet and nutrition, because there are so many factors and individual sensitivities and other things. So one person can have celiac disease or gluten sensitivity, and another person may not. So that first person may actually have horrible health overall when they eat grains, whereas another person might have perfectly fine health when they eat grains. And so recognize it. So there's not a one-size-fits-all diet is essentially what I'm saying. That there can be one-size-fits-all general health diets, that work for a lot of people or even most people. But diet nutrition is usually the trickier one.